everybody, and welcome to this interview with Amelia Greenberg, the Deputy Director of the Social Performance Task Force and a very experienced professional in the financial inclusion sector. Hi, Amelia, and thank you for joining us.
Hi, thank you for having me.
So I'm Joana, a financial inclusion specialist at European Microfinance Platform. This year, e-MFP received several session proposals for the conference on outcomes and measurement and management. And this signaled the strong interest of our members in this topic. And we have 6 sessions in the stream, impact and outcomes measurement, during the 3 days out of the conference. Certainly, a part of this increased interest follows the COVID-19 pandemic and different initiatives that took place to measure its effects, especially at clients and FSP's levels. But it also reflects the more than 15 years of work in this field, largely led by SPTF, and that has been discussed, experienced, and field tested by FSPs, investors, think tanks like CCAP, and regulators. So it's a great pleasure for us to have Amelia with us to talk about this work, where we currently are, and what is in the future for outcomes management. So Amelia, I will just start by asking, what is outcomes management and how it is related to the universal standards for social and environmental performance management?
Okay, well, I'm really, again, very glad to be here talking about one of my favorite topics. So thank you for the invitation. I'm going to answer that question in detail, and I'll start with defining what outcomes themselves are. So outcomes are the changes, both positive and negative, that clients experience, in this case, from using financial products and services. And we use the word outcomes very carefully instead of impact. Impact requires proving causality, and there is certainly a time and a place where that's really useful, but it is also complex and costly. So what we talk about are outcomes, which are the changes that can be plausibly associated with the intervention of a financial service provider. When you're measuring impact, you are doing a control trial, you have a control group and a treatment group. You're testing over a very long time horizon, and you have to wait a long time to get your results. And outcomes is a much shorter kind of connection of what's happening with the clients right now that you can collect on a weekly or a quarterly or an annual basis. But it really is more of a daily, weekly sort of everyday ongoing part of your management process to get some feedback about what's happening with your clients. So that's an important distinction. To define outcomes management, this is a multi-step organizational system for the collection, analysis, and use of outcomes data. And we use the term outcomes management to emphasize that this is part of an organizational process and that it is part of a process that has a feedback loop to ensure that the information collected at the client level is relevant for the FSP. And it needs to be useful not just for the FSP when it reports to external stakeholders, but also for its own decision making. So it's really a lot more than collecting outcomes data. It starts with identifying what data would be useful to the financial service provider. And then you set up the system to collect the data, which is not only who's going to collect it, but also who's going to ensure the accuracy of that data and how are you going to store it. And then there's the piece on analysis and then reporting the analysis to the right people so it can actually inform decisions. Joanna, you also asked how outcomes management relates to the universal standards. To get very detailed information about the universal standards, I encourage you to listen to the session that I did at this conference with SPTF Director Laura Foos. We did a little fireside chat about the universal standards. But I'll limit my explanation here quite briefly to say that it's a manual full of management practices created by and for financial service providers. And in global, it represents all the different areas of management practices that an FSP should have in place in order to achieve their social goals. And the first dimension of this manual is called social strategy, and it's within that dimension that we include the management practices that are specific to outcomes management. So this manual is something that SPTF manages, even though we get the data from FSPs in the field who are doing the work. But we document it all. We create the manual based on that input, and we review it every 5 years to make sure that the manual continues to reflect best practice. So we've just been wrapping up now our latest review, and there are 5 key areas that I would say that have changed. Sort of reinforced and strengthened what we used to say about outcomes. So those newer elements now are one, we've tied what we say about the outcomes that a financial service provider can be targeting. We've tied that to be more grounded in the reality of what the evidence shows us that a financial service provider can achieve. So what the research shows is that, first of all, you can achieve greater inclusion of people who are previously excluded. We also do see evidence that financial services helps clients cope with shocks, so they become more resilient. And can sort of smooth their consumption of basic needs over the year, even as they have times of plenty or of famine. And evidence also shows that financial services can help clients invest in economic opportunities. So those are the more realistic types of outcomes. There are also others, and the manual leaves place for you to talk about others that you might be targeting. But we try to focus on what's really realistic. So that's one change. Another major change is an emphasis on qualitative data as well as quantitative. We think both are essential to understanding what changes are happening with clients, and both have their strengths and weaknesses. But when you collect the quantitative and the qualitative, you get a really sound picture of what's happening with your clients. We also added a focus on emphasizing that you need to be tracking negative outcomes and not just positive. I think before we said define what your goals are and then decide what indicators you're going to use to measure progress toward those goals, and that's still valid. But you also want to be assessing whether anything unexpected and bad is happening to your clients, maybe as a result, even if it's an unintended negative consequence, as a result of their use of financial services. So we do say now explicitly that you need to be thinking about if any negative outcomes are occurring. And a fourth element is that relates not just to the client, but to the household, because sometimes the use of financial service providers can have an effect on her children, or also her relationship with her spouse, or there can be other stresses that come up that it's useful for the financial service provider to explore. And the final major change in what we say about outcomes measurement in this latest version of our manual is a real emphasis on segmentation. It's extraordinarily valuable to segment your analysis so that you can be tracking different outcomes for different types of clients. And we specify 4 segments that, in particular, every financial service provider, regardless of your goals or your size or your location, would find it relevant to use. And those are the gender of the client, the age of the client, the poverty level or the income level of the client, and the location, by which we mean, are they rural or urban? So having segmented data really allows you to understand what's happening for different clients.
Thanks, Amelia, for such a detailed reply. But tell us, is there a business case for collecting outcomes data?
So that's always the major question. And my answer is going to be yes and no, which I hope is not annoying.
Okay.
But what I'll explain is yes, there is a case if you collect the right kind of outcomes data, but we don't see a business case for a different kind. So more specifically, what I mean is that the shorter term, more immediate outcome impacts, like if you ask a client, how are you doing? Did you use this product? How did it work out for you? What did you do with it? Why didn't you do what you would hope to do with it? Maybe that kind of exploring of what happened in the immediate term is directly connected to what the financial service provider can control. And so it's really quite useful for the financial service provider to get that information. And there's certainly a business case for asking that. But we are finding that the longer term outcomes data, which we were really well intentioned about collecting, the ones like, have we alleviated or eliminated poverty among our clients? And we were saying, track a client segment through years and years and see if their lives have improved. There's still a place for that, but it's hard to make a business case for it because there are so many other factors that influence whether that outcome ultimately occurred. The longer the time horizon, the more complex the issue, the more there are other things affecting it. So I saw this nice little grid that one of our impact investors had developed that basically said, you could be lucky or unlucky, and you could have good financial services or not good financial services, and all those things come into play. So maybe 5 years down the road, you're doing better, but it's not because you took a loan. It's because your son got a job and is sending home remittances, or because the entire economy of your country has improved. And likewise, maybe there was a coup or a drought. So it's really hard to tie those longer term outcomes to the direct intervention of the financial service provider. And that makes those data very difficult for the financial service provider to use to make decisions. So I can give some specific examples to get back to where there is a business case. And for example, say that you gave a loan to a client and she didn't get to use it for what she thought she was going to use it for. And in your outcomes data collection, you said, was this useful to you? Did you invest in your business? And she says no. And you say, why? She says, well, I had a health shock and I ended up needing to use, my spouse got sick and I ended up needing to use that money for hospital fees. That can trigger some thinking for you, which is, if she wanted to use that for her business, but she ended up using it to pay for health fees, why wasn't there a different option for her? Does she need health insurance and she didn't have it? Or should we be offering an emergency loan, but we didn't? Or should we be doing some sort of non-financial service about preventive care that would ultimately help people not have sort of the negative health experience later on down the road where they have to be hospitalized? So all those things can trigger interventions or choices that the financial service provider itself can make so that the next time this woman takes a loan for her business, she gets to use it for her business. Another example I heard recently that was related to COVID was someone said they were interviewing their clients, we were trying to help you and we have the savings product and now COVID has hit, and did it help that you had this savings saved up with us? And the client said, we definitely use savings to help us get through the shock. But when the financial service provider looked at its quantitative data and looked at the savings balances, there was no change. And so they didn't understand how the clients could say, yes, the savings helped me and I'm glad I had savings, but then they didn't see a change in their savings accounts. And it turned out the clients had some difficulties where they were using sort of more informal savings, but not withdrawing from the branch itself. So they realized they needed to do some work to make that money more accessible and maybe a little more client education around the use of the savings product. And the last thing I would say, and it has to do with the negative outcomes, is one of the unintended negative consequences, unfortunately, of microfinance can be an increase in child labor. And we've been working with Grameen Foundation on learning from their research. And sometimes a client repays her loan on time. And if you're just looking at that quantitative information, you don't know about the stresses she experienced. But when you inquire, was this stressful for you? Was it, did the loan help you? She might end up saying, well, something happened and I had a shock and I ended up having to pull my child from school and have my child work in order to help me repay the loan. And as a financial service provider, you can think, what could I have done differently? Maybe we could have reached out to her or let her know we could have rescheduled the loan, or we could have offered an emergency loan, again, something to prevent that negative outcome for her child leaving school. So these are all really strong business cases for outcomes data. And as long as you focus in that area, I think you're getting information that's really vital to running your business well.
So now that we have established the relevance of the outcomes data and the types of outcomes data, what are the main challenges to collect this type of data?
Yeah, so I can answer this quickly. I mean, it always comes down to resources. So you have your budget and you have your time. And I would say also the capacity to analyze data can be weak in institutions, but you want to think about solutions to all of those things. So certainly you can collect a targeted smaller number of indicators and still get really, really relevant information. You can use a sample instead of a census basis. You should invest in building internal capacity to analyze and use the data, because otherwise it has no point. And the last thing I would say is really think about embedding outcomes data into existing systems. So please don't think of this as another division, another department, another process, but where are your existing touch points with clients where you're already talking to them? Can you embed a few more questions about client outcomes into those existing systems? And that makes it less onerous for the FSP to go get these data.
Thanks, Amelia. I think we're reaching out the end of our time. So I wanted to ask you, what are the key takeaways that you want our listeners and people watching the interview to take with them about the outcomes management?
Well, first of all, I hope that you realize the relevance. So it is relevant. Really focus the questions on understanding how the client's doing, both better or not better. Segment that analysis, mix the quantitative and the qualitative questions, and really embed this information. I would say use it along with all the other information you have about your clients to get the best picture you can of what they need and how you can adapt your products and services to have the most successful outcomes for them.
Wow. Thank you very much, Amelia. It was really great to have you in this very short, and I think hopefully it will open the appetite for our viewers. And actually, we have, as we said, other sessions in the conference looking at outcomes measurement. Right after this interview, FMO will present a case study on the power of evaluations in impact management. And later today, Amelia will be moderating a session on outcomes and impact and outcomes measurement from the FSP's perspective. And Cécile Lapenou from Cerise will do the same, but in a session about the investor's perspective on this topic. And tomorrow we'll have two other sessions. One on the impact of non-financial services in rural Bolivia, and the other a panel discussion involving CGAP, AFI, the Alliance for Financial Inclusion, and a regulator from Peru, talking about outcomes-driven regulation for the financial inclusion sector. So we hope you enjoyed watching this interview, and that you have the opportunity to attend other sessions as well. And thank you for watching, and see you soon. And thank you very much, Amelia, for this little bit talking about outcomes management.
Thank you again. I look forward to listening to all those other sessions.